Adriana, thank you. We're now joined by Dr. Jeff Pothof from UW Health to discuss the coronavirus vaccine. And Dr. Pothof, tell me, as healthcare workers and long-term care residents are getting the first vaccines, when can we really expect to see that expand out to the rest of the population?
I think if we're talking about, large groups getting vaccinated, people in the community who want a vaccine getting a vaccine, we're probably looking at, late February, early March for that stockpile to get large enough where that's something that you'll see all over the state.
And of course, knowing that timeline, that is not a time for us to lax and be steady now that we know we have a vaccine.
Right. The trend line in Wisconsin looks good. The news of the vaccine is just so encouraging. But, a stark reminder that right now we do still have a lot of COVID-19 in our communities. We still need to mask up and socially distance. The game's not over yet. We're getting close, but we really need to be diligent these last few months.
Dr. Pothof, what part of the population do you think needs to get this vaccine to where it will have the impact on the numbers to make sure that we don't have this come 2022?
Right. We really want to see a fairly large proportion of the population get vaccinated. If we can get, 80% of the population vaccinated, COVID-19 would have a very difficult time passing from person to person. So that'll take some time. But, the light is on the horizon. We're going to get there. We just have to hold the course.
And of course, everyone, thinks, are there any side effects to this vaccination?
There are some side effects, and most are very mild. They're managed with Tylenol. Some discomfort over the injection site's the most common. Some people will get fatigue, occasional headaches. Fevers aren't very common, but some people will have a fever because of the vaccine. But like I said, all very manageable. Take some ibuprofen, some Tylenol, and folks will be fine.
All right, Dr. Jeff Pothof with UW Health. We appreciate you taking that time with us today.
Thank you.